Good evening. Hi there. Hope all of you are safe, sound, healthy, wealthy, and wise. Every day, I only tell myself that every time I come face to face with all my friends and all of you here on this digital platform on Talk to Bhupen, I always hope that first and foremost, all of you remain safe and sound because safety and health today, folks, is of paramount importance. On Talk to Bhupen, every day we try and put up some facts for you, some data points for you, which otherwise you will not get to see. Some points, some specific instances that you should be aware of to ensure that people are completely completely in touch and aware of what the reality is. What we will do tonight is that we will be looking at exactly what is going on within the political class. Why is it that what we should have known, what we should have seen, why is it that the instances, the the examples which should have been set by the political class of how to lead in terms of a crisis, why is it that suddenly everything appears to have gone haywire? We have compiled a whole list today, an entire list of graphics, an entire list of data points, which will convince you exactly how this story of politicians sometimes misleading us and misguiding us really takes place. That's the blunt question, folks, that you really need to be focused on. The community transmission threat and just how serious is this threat? How bad is the situation? And why am I saying how serious is this threat? Because while we should only and only be focusing on the seriousness of this threat, to my great horror, to my great disappointment, what we're seeing is that an attempt is also being made somehow to start talking about an impending election. Here, wherever you think of, wherever you see, whoever you speak to between Delhi, Mumbai, top cities, people are thinking, how am I going to get the next bed? Am I in a position in which I can get hold of a bed? But in a state like Bihar, where elections are due to take place towards the end of the year, and in that state where the average testing rate is 1/10 the testing rate which is happening in big states like let's say Maharashtra or in Delhi, an average testing rate of 820 citizens per million citizens. Can that ever be considered an acceptable rate? And we want to fight an election in this state. Bear in mind, we are talking about fighting an election in this state. So today, folks, I have a very blunt proposition before you. And Vijay Shankar Pandey, whom I've always described as one of the foremost and honest bureaucrats in this country, this is what I want to put up. Should all the money meant for Bihar polls, should it be spent on fighting corona pandemic? The thousands of crores which will be spent, live broadcasting of public rallies, LED screens being put up in different places, have politicians simply lost touch with all reality? I'm demanding, why should money which is being spent for preparation of Bihar polls, why should that money not be spent on fighting corona pandemic? Vijayji, straight away I want to bring you in on this one, sir. Where do you stand, Vijayji? Where do you stand on this question? If I was to ask you, is it really possible for us to think in terms of simply moving away from all the expenditure which is taking place for the sake of Bihar elections? Is it possible for us, Vijayji, to move beyond, to think in terms of spending this money only and only for public welfare?
Bhupenji, you are absolutely right that before we think about election, we have to save people's lives. And Bihar is the state which is going next to elections. And recently, you must have seen, I also saw, a video kind of public meeting, and all the efforts and resources are now getting diverted towards that. It is very unfortunate that the state is at a very low level as far as testing goes, and you have already mentioned the data. And it is very surprising, Bhupenji, that it's not the shortage of money. It's a
Hmm,
basically, people have just lost the will to do anything. They just
hmm,
feel that things should just drag on, and somehow or the other. A situation will improve. It's not going to improve like that. We have seen the
hmm,
worldwide experience. People have gone seriously after this virus, have tested a lot of their population, taken all the required measures to control the pandemic. Here, what we are seeing, people are fighting their own little battles. See the testing rate that you have mentioned. As a country which has 137 crore population, and Bhupenji, there's no dearth of money. And there's now, at present, our country is producing lots of kits also. If people want, if the governments want, they can certainly rack up the testing figures and do the required thing. And unless we test large number of people, unless we quarantine them, unless we cure them, things are going to become worse. You very rightly pointed out that at this time, the government of Bihar must focus all its energy towards
Government of Bihar must focus all its energy is only and only for fighting this pandemic. If you're in a state where you're testing 820 citizens per million citizens, I think it's absolutely shocking. Dr. Lal is there with us as well, and he's a former chairperson of the Indian Council of Medical Research. Dr. Lal, please explain to me, Dr. Lal, as I look at all the numbers which come in, as I look at the testing rates per state, and as I look at the death rate, as I look at the recovery rate, please tell me, where exactly are we, Dr. Lal? Where exactly are we when it comes to fighting this corona pandemic? If we move beyond Bihar, and if we look purely in terms of what is happening in terms of our state of preparation, do you think we're in a good spot? Dr. Lal, can you hear me? Goel, Dr. Goel. I was hoping that I was looking for another doctor. Dr. Goel, if you can hear me, sir.
Dr. Goel, I am a formal president of the Medical Association.
Or Delhi Medical Association. Yes, there was another doctor who was supposed to join. I think there's a problem with the link. We'll get to him. We'll get to Dr. Lal.
That's fine.
Dr. Goel, what I really wanted to know is that while we're trying to look how bad is the situation, and if I start looking at it in terms of where is the testing rate of each state, do you think we are at that position where we can take our eyes off from fighting this pandemic and start thinking in terms of spending money on elections?
No, what you have said is very, very right. I would rather try to focus on Delhi preparation as far as the testing is concerned and preparedness of the COVID beds are concerned. So Delhi needs, as projected yesterday, 80,000 beds on 31st of July. And till now, we only have 9,000 beds in government and private sector. And obviously, you need a lot of money. As far as the election is concerned, the elections are going on. That's also part of democracy. I would not go into that. But I think we need more money to invest in preparing beds, in more testing. Delhi at present is doing about 5,000 to 6,000 per million testing. But I think Delhi also needs more testing now, maybe 10,000 plus or more. But we need beds, we need home care facilities, we need quarantine beds. We also need now the zero surveillance. As you said, zero surveillance also. So we not only need beds, but we also need the home care and quarantine facilities other than the RT-PCR testing and the zero testing. As far as your question is concerned, the money is going to go in Bihar elections. So I would like to add here that the elections had to be there. That's a part of democracy. So if instead of say real rallies where the lakhs of people join in those rallies, if the virtual rallies are done, I think that's also saving money. That's also a point of view. But you can always say.
But Dr. Goel, I'm looking at numbers, sir. Now, this graphic that we're playing right now, COVID death rate per million people in states with 150 plus cases from the 25th of March to 9th of June. अब आप देखिए कि साहब बिहार की क्या परिस्थिति है. बिहार में देखिए कि पर मिलियन सिटीजन्स डेथ रेट क्या है 0.26. अब मेरा आर्ग्यूमेंट ये है कि आप टेस्टिंग कर नहीं रहे. आप टेस्टिंग कर रहे हैं 820 लोगों की पर मिलियन सिटीजन्स. दिल्ली में टेस्टिंग हो रही है 13,000 लोगों की पर मिलियन सिटीजन्स. बिहार में डेथ रेट दिखा रहा है 0.26. दिल्ली में डेथ रेट दिखा रहा है, देखिए कहां पर है 46.71. तो मेरा कहना ये है कि ये जो फिगर है सर, ये 0.26, is it not time for us to focus only and only on the validity and authenticity of this figure rather than making tall claims about what special package will be given to Bihar? I mean, is that not the real situation today?
Your argument is that this 0.26 death rate is little less when it should be high as compared to Delhi. It is little less because
Correct.
testings are not done in Bihar. That's what is your point of view. But what I'm saying is, but you can't hide the deaths. So you can take the number of deaths. If it is more because of the COVID, then the COVID suspects will be there. More COVID suspects will be there. In Delhi, there are COVID suspects who are also dying, and the COVID positive patients are all dying. I agree that Bihar should have more tests. Yes, this goes without saying. But as far as the death rate is concerned, I feel the death rate in Bihar is low, possibly because of various local regions. Because Delhi is densely populated, you need to consider that. So demography of Delhi may be different than demography of Bihar or demography of Uttar Pradesh, where especially in rural areas,
But
people.
आप क्या मानते हैं? नहीं डॉक्टर गोयल, आप ये कह रहे हैं कि दिल्ली में अगर 13,000 लोगों की टेस्टिंग करके अगर एक नतीजा आता है, आप ये कह रहे हैं बिहार में 820 लोगों की टेस्टिंग करके भी अगर वो आंकड़े आ रहे हैं तो आंकड़े हमें मानने नहीं है, मतलब दोनों का अनुपात यानी प्रोपोर्शन जो है बराबर हो सकता है आपके मुताबिक?
नहीं, मैं क्या बोल रहा हूँ कि बिहार में हो सकता है बीमारी इतनी नहीं फैली हो, ये मैं कहने की कोशिश कर रहा हूँ। टेस्ट होने चाहिए और होने चाहिए, ये मैं नहीं कह रहा, लेकिन हो सकता है सिम्टोमेटिक पेशेंट्स वहां कम हो। अगर सिम्टोमेटिक, ये तो अपना डेथ कम है। अगर
ये कैसे माने डॉक्टर?
कैसे मैं बताता हूँ, लाइक हॉस्पिटल्स में कितने लोग आ रहे हैं दिखाने के लिए, उससे हम लोग कह सकते हैं कि सिम्टोमेटिक पेशेंट्स कितने आ रहे हैं, चाहे नर्सिंग होम है या हॉस्पिटल हो, प्राइवेट हो, गवर्नमेंट हो, कितने लोग अस्पताल में दिखाने आ रहे हैं। दिल्ली में तो हर तीसरा आदमी आज बुखार से पीड़ित है, वो दिखाने आ रहा है, अस्पतालों में दिखाने आ रहा है डॉक्टर्स को। तो इसलिए दिल्ली में हम लोग जानते, फिर उनके टेस्ट भी इसीलिए ज्यादा हो रहे हैं। आईसीएमआर की गाइडलाइन है कि एसिम्टोमेटिक कॉन्टैक्ट्स के भी टेस्ट होंगे, सिम्टोमेटिक कॉन्टैक्ट्स के टेस्ट होंगे, सिम्टोमेटिक हेल्थ केयर वर्कर्स के होंगे, ऐसे देयर आर 8-9 गाइडलाइंस। तो मुझे लगता है कि यहाँ बिहार में जो आप सिर्फ इसको ये नहीं कह सकते कि टेस्ट कम हो रहे हैं इसलिए डेथ रेट कम है। मुझे लगता है सिम्टोमेटिक पेशेंट भी शायद कम है बिहार में, बिकॉज मैं बिहार गया नहीं तो कह नहीं सकता, बट ऐसा मेरा एक डॉक्टर के नाते अनुमान है कि बिहार में सिम्टोमेटिक पेशेंट्स अगर अस्पताल में आते तो टेस्ट भी ज्यादा होते, एसिम्टोमेटिक पेशेंट्स के वहां कम हो रहे हैं, ऐसा मुझे लगता है।
अच्छा, now you know, I want to look at another factor, because there is a fear which is being expressed that there are states which are covering up data. I want Vijay Shankar Pandey to come into that one. Vijay ji, ऐसा मुझे मैं बड़े लोगों से मेरी आज दिन भर चर्चा हो रही थी और लोग मुझे ये बता रहे हैं कि एक प्रयास किया जा रहा है विजय जी कि somehow to try and cover up the numbers. Specifically, this allegation is being made in the case of UP and Gujarat. Because the funny part is that look at the testing which is taking place for million citizens in Gujarat, 3,443, and look at UP, 1,470. So already when it comes to states which are showing more positive numbers like Delhi or Maharashtra, the testing is way too low. Could it be, Vijayji, that the government of the day has now decided that the best way forward is to go in for herd immunity, and the best way for herd immunity to be built is for people to get beyond this fear of corona pandemic, and if they end up showing some signs, well, so be it, let them learn to live with it. Would that be a possibility, Vijayji?
Bhupenji, it's a part of strategy. I have no problem with any strategy. I just want that the government should, in its considered opinion, understand all the factors, consult all the experts, and they decide a strategy. And let them come out and say that. Let them say honestly to people that we are following this strategy, that let there be herd immunity. So we will not be testing, we will not be doing this, we will not be doing that. But they can't do that because they know there will be backlash and if they'll be criticized. So that's not a strategy which has been accepted worldwide, at least as far as today is concerned. Maybe it is after some time. The issue is that, Bhupenji, looking at our population, we are not testing enough. This is very clear by the facts that you have brought out and very clear by the data that has come out in the public domain. So the governments don't have any other option but to do certain things. They have no other strategy. You have to test people. Those who show symptoms, they have to get admitted. They have to be treated. Come what may, you have to follow this strategy. So instead of trying to invent some new strategy and trying to try to show less number of cases, it doesn't help. Bhupenji, today you can show less number of figures, but when it spreads and starts killing people, then what will you do? People start showing up the hospitals, start asking for admissions, then what will you do? So the better strategy is to control its spread, and then create the required infrastructure so that if it spreads, if people catch the virus, if their condition gets serious, then at least there is some facility available to treat them. People at the governments at present are not making enough effort. Bhupenji, this is my take. I have also read a lot of literature on that. I've spoken to a lot of people. The sincere effort is, you have to understand that this virus is going to spread. The numbers are going to become large. Don't get disheartened by that, or don't get scared of that.
But why but Vijayji, is it true? Is it true that states like UP, is it true that states like UP and Gujarat are effectively trying to cover up the numbers, trying to give the sense that all is well? If that was to be a strategy, would you agree with that strategy as a former bureaucrat?
Bhupenji, just cannot be accepted. This is unacceptable. You can't hide numbers. It doesn't help you. Bhupenji, now if you can save the day today, you will not be able to save it tomorrow, because if it spreads, affects people, makes them sick, what will you do? They will start showing up. No country can afford this kind of strategy that don't show the numbers. It's not like any other number that will get hidden. It's a people's life. People will speak out immediately the moment they get affected by it, and their health starts deteriorating. So this is a strategy which no state should ever think of following, come what may. And all the people who are working in these states, it will be my humble opinion to them, please don't do that. It doesn't help anyone, neither your state it will help, neither the people, nor the government. Ultimately, everybody will be made to pay very heavy price.
Yes, Dr. Goyal, आपका क्या मत है सर? अगर स्ट्रैटेजी ये निकले, क्योंकि ये भी सच है, बहुत से जैसे किसी को पता चलता है, साहब देखिए मैं नोएडा में मैं रहता हूँ, मेरा घर है, वहां पर जिस सेक्टर में मैं रहता हूँ वहां पर कुछ लोग पॉजिटिव हुए हैं, लेकिन जो लोग पॉजिटिव हुए हैं उनका संज्ञान वहां का एडमिनिस्ट्रेशन नहीं ले रहा है. तो अगर मान लीजिए हम अपने मानवीय डर से निपटने के लिए अगर हम ये सोच के बैठे कि साहब हम इसके बारे में चर्चा नहीं करेंगे, हम इसमें हवा नहीं बनाएंगे, क्या ये सही स्ट्रेटेजी होगी आपके मुताबिक?
नहीं, ये तो खैर स्ट्रेटेजी ठीक नहीं है. अगर टेस्ट करना है तो करना चाहिए. अगर एसिम्प्टोमेटिक लोगों का आज टेस्ट नहीं करेंगे तो निश्चित रूप से वो फैलेगा. जब एसिम्प्टोमेटिक लोगों को सिम्प्टोमेटिक हो जाएंगे तो ये पूरा कम्युनिटी में फैलेगा, इसमें कोई डाउट नहीं है. So obviously more testing is needed, more asymptomatic patients needs to be tested so that we know the extent of disease. We can have the projection for the future, how many beds we need, how much infrastructure we need. तो ये testing और treatment and isolation, ये तो
आंकड़ों को नहीं छुपाना चाहिए. आंकड़े आप छुपा नहीं सकते.
नहीं, छुपा भी नहीं सकते. देखिए मैं दो बात कर रहा हूँ. मुझे लगता है एक है एक्सटेंट ऑफ डिजीज जानना है. एसिम्प्टोमेटिक पेशेंट्स को हम छुपा रहे. बेसिकली टेस्ट किसका नहीं करना है? सिम्प्टोमेटिक का तो होगा ही होगा. एसिम्प्टोमेटिक पेशेंट्स का टेस्ट नहीं हो रहा है, जो कि कम्युनिटी ट्रांसमिशन का एक कारण बन सकता है. और मुझे तो लगता है दिल्ली में कम्युनिटी ट्रांसमिशन की स्टेज में हम लोग पहुंच रहे हैं. कम्युनिटी ट्रांसमिशन का मतलब क्या है? कि आपको किसी को कोरोना है और उसका कॉन्टेक्ट नहीं पता चले, वो किसी कोरोना पॉजिटिव के संपर्क में नहीं आए, नॉन कोरोना पॉजिटिव के, दैट इज व्हाट इज नोन एज कम्युनिटी ट्रांसमिशन. दिल्ली में 27% केसेस में टेस्ट हो रहे हैं, उनका 27% पॉजिटिविटी रेट आ रहा है. तो इसका मतलब है एवरी 4th पर्सन इज कोविड पॉजिटिव एज पर द टेस्ट. इसमें अगर एसिम्प्टोमेटिक लोगों का और हो जाएगा तो मुझे लगता है ये रेशियो 40-50% पे पहुंच सकता है. तो कम्युनिटी ट्रांसमिशन तो दिल्ली में वो स्टेज आ चुकी है ऐसा मुझे लगता है. और बाकी जगह खासतौर से मुंबई में, अहमदाबाद में, जहाँ बहुत ज्यादा डेंसली पॉपुलेटेड पॉपुलेशन है, वहां पर काफी हम कम्युनिटी ट्रांसमिशन के नजदीक पहुंच गए. अभी एसिम्प्टोमेटिक का करना है तो क्या हमारे पास रिसोर्सेज हैं? ये छुपाने का ही इशू नहीं है, हमारे अपने रिसोर्सेज भी देखना पड़ेगा. जो सरकारें कह रही हैं कि पता चला सिम्प्टोमेटिक के कर नहीं पा रहे, एसिम्प्टोमेटिक के टेस्ट कर रहे हैं. हालांकि दिल्ली में फिर वो रिवर्स हो गया, एसिम्प्टोमेटिक के भी टेस्ट हैं. बट हाँ स्टैटिस्टिकली स्पीकिंग एसिम्प्टोमेटिक का टेस्ट होना चाहिए जिससे कि वो एसिम्प्टोमेटिक को आइसोलेट किया जा सके और कम्युनिटी ट्रांसमिशन को रोका जा सके।
आई एग्री। आई थिंक डॉक्टर गोयल आपकी बात में काफी दम है कि आप आंकड़े छुपा नहीं सकते, चाहे वो सिम्टोमेटिक केसेस है, एसिम्टोमेटिक केसेस है। विजय जी, देयर इज अ सेकंड पार्ट टू दिस डिबेट एज वेल, एंड आई वांट माय प्रोड्यूसर्स टू प्ले दैट ग्राफिक नाउ अप ऑन द स्क्रीन्स, व्हिच इज दिस पीएम केयर फंड। बहुत चर्चा है ऐसी विजय जी कि जो गैर भाजपा राज्य हैं जैसे दिल्ली है, उन लोगों का ये आरोप है कि केंद्र से हमको पर्याप्त मात्रा में आर्थिक मदद नहीं मिल रही। Should there be transparency? Can there be transparency on how PM Cares fund is being spent across state, Vijayji? As a bureaucrat, how can you bring in more transparency?
Bhupen ji, this is a national pandemic, and central government is duty bound to send money to all the states as per their requirement. This is the commitment that the country has made to all the states, and this is its primary responsibility. As far as आप जैसे आपने पीएम केयर फंड का बताया, देखिए ट्रांसपेरेंसी के बिना तो डेमोक्रेसी चलती नहीं, इसलिए चाहे वो पीएम केयर फंड हो चाहे और कोई फंड हो, भूपेन जी, यू हैव टू कम आउट विद डिटेल्स। द गवर्नमेंट, सेंट्रल गवर्नमेंट हैज टू पब्लिश how much money it has received so far, how much it has dispersed to all the states respectively. Unless you do that, there will be complaints against the central government for differentiating between one state and another, BJP ruled states and non-BJP states rules. States, why don't they publish the data? It's such a simple thing. And let me tell you, Bhupenji, even if it is not a government set up body, so-called as people are saying, it has to be accountable with PM, its chairman, and all the cabinet ministers and its members. How can you say that it's a body outside the purview of CVC or somebody or RTI or anything? This kind of body, whatever is shaped, it has to be transparent. It has to come out with all the details. Bhupenji, they have to give the details.
Ultimately, yeah, that's what I'm saying. I'm saying it's a constitutional post. The Prime Minister's office is a constitutional post. Now, if the Prime Minister's office is distributing some fund, should we not know exactly which state is getting how much fund? Is that a valid question to raise?
Bhupen, absolutely 100%. This is a publicly collected fund. You have to tell the nation how much money has gone where, which state you have given how much, and the public should know whether there is any kind of discrimination being done between the BJP ruled states and non-BJP ruled states. It has to be done. There is no doubt. I think there should not be any debate on that. PM Care Fund is a publicly funded body chaired by the Honorable Prime Minister of the country. How can this body be not transparent and not tell people how much money it has received, where it has spent, how it has spent? So there is no question, Bhupendra, you have to do that.
I think, gentlemen, thank you. That's the end of the show for us tonight.
Thank you.
Thank you, sir.
Thank you.
Thank you, doctor.
Thank you. Thank you.